Christmas Eve, ruptured globe after a full day of surgery. Let's go. Welcome to the channel. I'm Zach with Dr. Eyeball MD. If you are new, I'm a third-year ophthalmology resident. On the channel, we focus on that medicine, ophthalmology, residency, soon to be fellowships related. Go ahead and subscribe to the channel if you are interested in any of that stuff. Today, we're going to do a vlog-style video. I'm going to take you along day in the life of an ophthalmology resident. We have surgeries, we have post-ops, we have open globes, lid lacs, crazy stuff in the ER. It's a long night. Let's get into the vlog. What's up, guys? Zach here with Dr. Eyeball MD. Welcome back. It's been a while since we've done a vlog style video, but tomorrow I have 4 phacos. I'm going to take you along day in the lifestyle video of an ophthalmology resident doing cataract surgery. We're going to get there early tomorrow. I have to actually see the surgeries that I did today starting at 6 a.m. tomorrow before I do the surgeries for tomorrow that start at 7:30 a.m. So we're going to get up super early to go see those post-ops. Then we're going to do the surgeries. Then we're going to see the patients that we do tomorrow for surgery on as a post-op day 0, because tomorrow is Christmas Eve. Yes, we're operating on Christmas Eve, and because they don't want to come back for a post-op day 1 visit on Christmas Day, we're going to see them on the day of their surgery, 4 hours after they've had surgery. Make sure they look good. I'll take you guys along for the ride. Let's go. So one of the things that I like to do these days when I wake up in the morning is actually make a protein drink. And since I am now on a low carb diet, I do a low carb protein drink with low carb almond milk and then low carb protein powder, and add a little bit of Splenda for flavor. And that is basically my breakfast in addition to a Monster. All right, I'm just leaving now. It's 5:30 in the morning, which is way too freaking early to be doing anything. And so I'm gonna head in and actually see the post-ops from yesterday, the patients that I did surgery on yesterday. So there were 4 that I did surgery on. Only 3 of them were able to come at 6 and 6:15 a.m. to have their post-op visit, which is really early. One of them couldn't make it because he's coming on a train. So he'll come later, and one of the other residents will have to see him as a post-op. Anyways, yeah, this is like the one rotation where we get there at like 6 a.m. on one day to see our post-ops before we operate on the other patient. So anyways, it's 5:30. I have about a 25-minute drive to get there, and we'll see the post-ops. They should look good. Everything went well in surgery, no problems. So fingers crossed, everybody's looking good. Maybe we'll get a post-op day 1 2020 or something. That'll be nice. Let's go. It's 6 o'clock, I'm walking in. The gates were locked this morning because it's so early. So I had to go around to actually get in the parking lot. Hopefully the doors to the hospital on the back side where I normally go in are actually open. I think they open at 6. So I'm gonna head in and hopefully see the 3 post-ops. Let's go. Unfortunately, none of the post-ops have shown up yet. And I think it's because the doors were locked. So it's actually Christmas Eve and they only opened 1 entrance, and it's a massive hospital. So I think people just couldn't get into the hospital. Or they didn't know to go through this one specific entrance by the emergency room. So none of them have come yet. 3 of the 4 were supposed to come early this morning, and they said yesterday they'd be here. So I think it's probably more an issue with having trouble getting in this morning. But anyways, if we don't have time to see them, which I prefer to see them myself because it's like an immediate feedback loop, you know, seeing the results of your surgery day 1 just kind of, you know, helps you know, like, oh, I did this in this particular surgery, and this is the way it looks the next day. You know, was I phacoing like too close to the endothelium? Did it cause more edema? Or, you know, that wound looked this way, and now it's sealed nicely still, or that kind of thing. It's good to have that positive, like, or that immediate feedback loop that you don't get if you can't see the post-ops yourself. So anyways, may not be able to see them because we're gonna have to run up to the OR here in like 20 or 30 minutes and get the patients for today started, the 4 patients for today. So we will see if anybody comes. If not, some of the other residents will have to see them as post-op day 1s. Anyways, it's definitely a bummer to not be able to see them also, because like one of the best parts about ophthalmology is like taking the post-cataract patch like off someone's eye And then them seeing for the first time in like a very long time. I mean, that's like one of the coolest things. And yeah, people are pretty happy about that. But so that's one thing that will get missed out on if I can't see them. But and all the surgeries yesterday went really well, so I expected them to, you know, see really well post-op day 1. But I actually tried calling them to tell them how to get into the hospital today, since it's a little different because it's Christmas Eve, but I haven't been able to actually reach any of them on the phone. So about to have to head up to the OR, so probably gonna just have to hand it off to one of the second-year residents down in clinic. So finally found the post-ops, and they look good. All of them looked really good, so we'll see them in a week. Out to OR, schedule people. So when I head up to the OR, I'll actually go ahead and do a full wet scrub initially, and then I'll dry my hands off after. Because when I actually scrub in for the case, I like to use the dry scrub like the Avogard, just because I don't like how wet my hands are before I go to gown and glove in. It's just difficult for me to ever get my hands completely dry after that. So I like to go ahead, do a pre-scrub, and then a dry scrub right before the case, and that is kind of the way I prefer to do it. Okay. So the first case went good, really well actually. So we'll see him later this afternoon for a post-op day 0. Yeah, went really good. We did divide and conquer, so going to the second one. Go mark him now. All right, 2 cases down now, 2 to go. Second case went well, lens in the bag. We'll see him this afternoon, see how he's looking. Gonna get some more lenses here for the next case and then go mark him. Okay, 2 down. The third one's marked. It's gonna be a white mature cataract. So it should be good. Haven't done one of those in a little while now. We'll see if it looks intumescent and decompress it with a needle, and just be real careful on the rexus. And hopefully she will have really improved vision from the surgery. So anyways, third case about to start. I came in to refuel with a little bit of caffeine. So my senses aren't dulled. Just kind of wake me up a little bit, keep going, then try to make it to lunch. So 2 more cases, let's go. Okay, so it's like 1:15 now, finished with 4 cases. So gonna move on to eating lunch and then go see these patients we just did surgery on post-op. Let's go. All right, we're done. It's only 4 o'clock. Normally don't get out of here till like 6 or so that's not too bad. Cases went fine. Post-ops looked good. And so we're done. And tomorrow is Christmas. So for some reason, it's become very therapeutic for me to go buy fake plants, which are consuming all the extra space in my house. And you're starting to see them pop up in some of the videos too. All right, so our day keeps getting more and more interesting. So it's 6 p.m. now. I just got a call from the first year at one of our satellite sites that there's an open globe being transferred for a piece of metal that flew into someone's eye. So there's an intraocular foreign body is the story. Also with the lid lac. So if it was forceful enough to cause a lid laceration, then there is a good chance that it is a globe. If they think there's metal involved in the eye, not like a corneal foreign body. So probably going to be doing that surgery tonight. And then also possibly a dislocated lens coming into the ER as a transfer. We don't really know much else about that one. And then also another transfer with trauma and extensive facial lacerations. Don't know any more than that. So sounds like we will be headed out to the satellite site, which is about 45 minutes away, to be doing surgery sometime later tonight. Waiting on the first year to get back to me once he's actually seen the transfer and we have a little more information, get a read on the CT and that kind of thing, and then go from there, guys. I've been up since 4:45 this morning and doing surgery all day, and apparently we're going to be doing it all night for Christmas Eve. What a way to spend Christmas Eve. But anyways, let's go home, take a shower, get something to eat, and then we will start our night of surgery. Let's go. So I finally get a video snippet of the CT from the first year, and you can see here the left eye is deflated compared to the right eye, indicating an open globe. You can also look for intraocular air, which is a good sign. I don't see any intraocular foreign body though. However, there is one in the soft tissue. All right, it is 6-something o'clock. Definitely open globe injury. Also a huge, full thickness, margin involving eyelid laceration. So we'll close both of those in the operating room here shortly. So gonna make the 40-minute drive out to this other hospital. We're gonna post this as an emergency, obviously, and then get it going. And then there's another patient in the ER now with a dislocated lens. We'll see what that means. Hopefully that's not another globe. I don't know any more to that story, so the first year's gonna go take a look, try to give us more info on that, and then we will do this surgery. Maybe we'll be doing another surgery. Anyways, it's actually 7 o'clock, so let's go. Okay, going into the ER now. Gonna swing by this other patient's room to make sure that it's not another open globe injury. The one that's like a sublux or dislocated lens or whatever they said. I'm gonna say it with the first year, and then we'll make sure it's not another globe that we need to start getting ready to go to the OR after the first year globe that we're going to do. And then we'll swing up to the OR. They've already come down to grab the patient. So then we'll go and make sure everything's ready for that case to go to the OR. Okay, so ran by the ER, saw those two patients. One has a dislocated sublux lens and a lot of macular commotion. And the other, I'm trying to find the OR. It's been a while since I've been to this one, this hospital. The other one has just nothing. It was just trauma. All right, well, about to roll back to do open globe repair, eyelid laceration repair. Probably take a couple hours, then we'll see where we're at with those two ER patients and go from there. One's gonna need retina because of the dislocated lens from whatever hit his eye. Doesn't seem to be an open globe, but definitely a dislocated lens. So we'll need retina intervention. Probably not emergently, but get them notified after all this. So it is 3 hours later, 4 hours later. I don't know, it's like almost 1 in the morning. Christmas Day, finished the globe repair. It took like 24 sutures. Big, involved the entire cornea, corneal lac, limbus to limbus, and it extended into the sclera too. And then it also was a margin involving upper eyelid laceration that went all the way from the margin to the brow. So I fixed that as well. So yeah, finished that. And meanwhile, while we were trying to kind of get that patient set up to go to the OR, we got motor vehicle accident patient who had a retrobulbar hemorrhage. Fortunately, she did not have elevated pressure or like a proptotic eye. We didn't have to do a canthotomy. It was a minor hemorrhage, but her more concerning problem was a likely traumatic optic neuropathy, but no ruptured globe for her. And then we had another patient who had something explode in his face while working with a drill. And so his lens was actually completely dislocated. It was like taken and just like sitting down at the inferior pars plana. You could see the top of the lens and it was just sitting there. And then had like horrible commotion all throughout the macula, so this count finger vision. So he'll need retina intervention. And then we had a patient, also while we were doing the open globe repair, who had a light bulb explode in his face and cause a partial thickness corneal laceration. So a lot going on Christmas Eve, basically. Anyways, so we got that stuff taken care of, and so we'll be on call. So I've been on call for 4 days, or well, it will be 4 days, I guess today. And so we'll see how the rest of it goes on Christmas Day. Driving home now. Gonna stop at McDonald's and get, I guess, Christmas Eve dinner that I missed. So haven't eaten, so gonna do that. I've been up since 4:45 this morning. Got up that early to go operate. We operated all day, then we did clinic, we saw our post-ops, and then we got home for like very briefly, and then drove out here and fixed an open globe and saw a bunch of horrible eye traumas, basically. So anyways, that's been my Christmas Eve. Let's go home. All right, guys, well, that wraps up a really long day of surgery, and then followed by seeing post-ops and then getting called in for a Christmas Eve open globe. Really terrible injury, complete corneal laceration, partial scleral laceration, big huge eyelid laceration, which was good to fix because I got some practice there for oculoplastics, which will be coming in a fellowship soon. And anyways, guys, that's the video. I hope you enjoyed following me along for day in the lifestyle video of a ophthalmology resident. If you did, leave a like on the video, subscribe to the channel. I'm Zach with Dr. Eyeball, and I'll see you guys in the next one.